Leaders from across Oregon send a strong message today. We need more urgency in vaccinating Latinos. It's a matter of life and death. They say the Latinx community has been left behind. Data from the state shows Hispanics account for only 6% of vaccinations in Oregon. They make up a third of COVID cases, but 13% of the state's population. Community organizations, elected officials, and healthcare providers working with the Latinx community came together for a press conference. They shared frustration about the rates, calling on healthcare systems and the state and federal governments to step it up.
The question that has gone unanswered is, why have vaccines not been prioritized for members in our community who carry the most burden of the virus? Addressing all of these potential barriers to vaccination, it can be done. We have seen it here in the state of Oregon and across the nation. We know we can do a regional approach and get vaccines to our communities. However, doing so, it will require intentional and deliberated action.
While Governor Brown said racial equity would be top priority in Oregon's vaccine rollout, these leaders say the eligibility timeline does not reflect that. The Latinx community faces several barriers. Many can't get to vaccination sites or access technology to just sign up for appointments. They fear requests to show their ID or proof of insurance. Events don't have trusted messengers who speak their language. The state said it's given organizations more money and federally qualified health centers more vaccine. But these leaders just say it's not enough.
We've been asking for additional resources for community-based organizations. We've been asking for better communication between the state and the Latinx communities. And we've been asking for more direct allocation of vaccines to our counties so that we can implement these programs directly.
They're calling on the government to listen to their recommendations. Those include the state working with them and paying for a Spanish registration hotline, planning vaccination events in familiar locations, and paying community organizations to staff those events.